All right. Well, I want to welcome everyone to Pandia Health's Facebook Live, as well as this is being taped and will be put on YouTube and probably clipped in many different pieces. Today, we're talking about postpartum birth control with MamaMend. And we are lucky to have the CEO of MamaMend, Sara Bates, who's a mother of two and has breastfed extensively, many, 13, 14 plus months. Amazing. And then we also have Pandia Health's Dr. Stephanie Culver, OB-GYN, beloved OB-GYN from the SoCal area and serving all of California for Pandia Health. Just a reminder, Pandia Health, we bring birth control to women wherever you have internet and a mailbox. We can deliver to all 50 states. If you already have a prescription, just tell us where it's at. We'll move it, bill your insurance, ship it to you, set it and forget it. Never run out of birth control in our watch. And then if you need a prescription, if you're in Arizona, Florida, California, Texas, or Wyoming, then we can write a prescription for just $20 once a year using our expert physicians. And if you use the code MamaMend, you'll get $5 off your telemedicine consult only if you need it. If you already have a prescription, you don't have to use our doctors. We're perfectly happy just delivering your birth control. And it comes with free goodies. So sometimes high chews, sometimes teas, sometimes lubricant, sometimes makeup samples, whatever that we can find from female-founded, female-led, or pro-women organizations. So we'll do a round of intros. And then if you have any questions, please put them in the comments and we're happy to answer them live. Great to see some of our patient care advisors on. Hey, happy. And Sara, why don't you take it away?
All right. Thanks, Sophia. So hi, everybody. I'm Sara Bates. I'm the CEO and co-founder of MamaMend. MamaMend is a digital health platform for childbirth recovery and postpartum support. So we help moms learn what's normal and what's not and who to go to for help with our week-by-week guide to childbirth recovery. You can find our app on both the Google Play Store and the App Store for iPhones. So check us out.
Amazing. And then Dr. Culver, if you want to give a little background.
Yes, I'm Dr. Stephanie Culver, and I am a board-certified OB-GYN and have the pleasure and honor to work at Pandia Health, making sure that access to birth control is wide and easy and that no women should be left without options. I also am a mother of 5 children, and not only did I be an OB-GYN, I actually practiced what I preached. So got information, and thank you so much for including me.
And I'm Dr. Sophia Yen, CEO and co-founder of Pandia Health. Went to MIT, UCSF, Children's Oakland, back to UCSF, then Berkeley for a master's in public health, and then landed as a clinical associate professor at Stanford and founded Pandia Health to make sure no one runs out of birth control in our watch. So I'm really excited to discuss postpartum birth control with Sara Bates, CEO of MamaMend.
All right. Well, I thought we'd get this started with a little bit of maybe a timeline as far as let's kind of think about if you're pregnant or have recently given birth. When is a good time to start thinking about birth control?
Dr. Culver, you want to say?
Well, I think the best answer to that is, during the time that you're pregnant, to have discussions with your provider. And depending on if it's you're going to a practice that has multiple providers or one provider, it's very important to start that conversation, get things documented so that the physicians that have your chart or follow-up visits that you're thinking, that you're contemplating, what is it that I see in my life? Do I see multiple children? Do I see one child? How would I like them spaced, and so forth? Because depending on working, not working, breastfeeding, nursing, or the interval or how difficult it was to achieve pregnancy will really determine which type of birth control or contraception that you should use after postpartum and when to initiate it. So those conversations have to start before. And then that will guide the provider and the patient as to which method would be best.
Yeah, I absolutely agree. Start talking about it in your third trimester at least, and start thinking about it even now. We did a survey, informal survey on Winnie, which is a parent support group, and about, I want to say 30 to 60% of people had their second child. So between 1 and 2, their second child too soon, because they didn't prepare with birth control, or they didn't use our birth control delivery service because they were too busy breastfeeding or just taking care of baby. Postpartum life is just crazy to run to the pharmacy, stand in line, get the medication, and then come back home. And so that's why, Pandia Health, I think, is such a blessing, because you set it and forget it. Let us worry so you don't have to. We ship it to you. We deal with your insurance. We get it to you. We make sure that you don't run out, which was a big issue for 30 to 60% of these women that had their second baby too soon, because they hadn't either had that discussion with their provider as to what they wanted to use, or they didn't think they could get pregnant. And you technically could get pregnant, 2 weeks, I think, is technical, but realistic is probably like 6 weeks, 4 to 8. But we definitely recommend, if you're going to be sexually active, you should use birth control. And you can start using birth control at 30 to 42 days postpartum. And we don't recommend using anything with estrogen if you're breastfeeding, because that will decrease the milk supply. But there are a ton of different progesterone only options.
It is said that after the first year postpartum, about 75% of pregnancies are unintended. And it's really important. ACOG really stresses that it's optimal to have at least 18 months in between delivery and then conception for the next pregnancy, for not only the neonatal health or the baby's health, but also for maternal health as well, and decreasing adverse outcomes. So it's very important to have those conversations before delivery.
Yeah, I think that's a great point. And just to kind of clarify, when you say 18 months, you mean 18 months from when one child is born to when you get pregnant, not 18 months between the children, right?
Yeah.
Yeah, because if it was between, then you would get pregnant at 9 months. But we need 18 months for the body to heal, get enough nutrition, so then you can make another baby that has maximal, ultimate nutrition. Because as we all know, if we're going to make a baby, we want it to have the best beginning in this world. And if you've been depleted of your iron, depleted of your calcium, which the baby sucks off while it's breastfeeding, as well as some of your calories, and then just the time to heal, it's at least 18 months so wait until your baby's 1.5 years before you have the second one. And as Dr. Culver mentioned, 75% have their second kid unplanned. And we would, want a world where you've always planned it and you have a perfect situation set up for the next one.
Yeah, that's a great point. So, kind of to your point earlier, Sophia, when you had mentioned that you really should start on birth control within, 4 to 8 weeks, or as soon as you're sexually active. What can you kind of comment on? There's a lot of people who think that, well, if I'm breastfeeding, I don't need to. That's birth control.
Yeah, so I'll start, and then Dr. Culver, you can jump in as well. Breastfeeding is not sufficient birth control. I mean, it is used as a method in countries who don't have access, and it is possibly efficacious, but you have to be only breastfeeding every 2 to 3 hours. Once you add anything, then you aren't covered. And then a lot of women will go on progesterone only pills, and that is as good as it gets until you stop breastfeeding, and then we can throw something with estrogen. And the only reason I bring that up is with progesterone only pills, our joke in medicine is, what do you call somebody who's on progesterone only pills? You call her pregnant, or you call her mom, because if you take it 3 hours late, it doesn't work. and you need to use some emergency contraception and or abstain if you're going to have sex in the next 5 days. If you had sex in the past 5 days, to be absolutely safe, you would use some emergency contraception. And again, when you're breastfeeding, you're just like so out of it. I can totally imagine just you missed it by 3 hours, which is just one breastfeeding, right? And you're like, oh no. And so I always recommend condoms plus something. And a lot of people are like, but I'm married, why would I use condoms? And my phrase there is, as a feminist, I don't want to leak semen for 24 hours. So if you're going to get off, don't leave any drippy drip with me. And I think that if the men drippy dripped for 24 hours, they would totally insist that we wear condoms if that was the situation. So I hope that people are empowered to ask for condoms. And that is a great method that won't interfere at all with breastfeeding.
Yeah. Ditto. You have to nurse consistently, and you even have to nurse. You can't even have 6 hours lapse while the baby's sleeping in order to continue that hypothalamic, down regulation to not have ovulation. So even the World Health Organization, because they have to monitor everyone globally and ensure breastfeeding and make sure that there's proper nutrition, they're okay with combined hormone contraception beyond 6 months. So if breastfeeding's established and you have good milk supply and you're very confident in what you're doing, you can use a combined oral contraceptive, post 6 weeks, but obviously maybe a little bit longer after a C-section, because again, you're adding estrogen back. But if things are really well established and you're worried about efficacy, then maybe 3 to 4 months, or as soon as the baby's starting to have a little more solid and your interval is increasing with nursing, then you can offer the combined hormone with estrogen and progestin.
And can you talk about, you mentioned about your supply, so as long as your supply is good, that should be safe. So would you say that that's the bigger concern with breastfeeding and the combined pills, or is there any concern about the hormones and the baby getting like that passing fluid to the baby?
No, I think the predominant, a lot of the evidence shows that once breastfeeding is established and that you are sort of going towards eating or feeding, that there's really, there isn't an increase of diminishing return or stopping early. So it has to be a decision made between the provider and the woman has to make some tough choices and actually knows what's best for her and her family and what's at ease. So if there's anxiety that's along with conceiving too soon and so forth, then have to make sure that decision is substantial. That's decision enough to go to a combined hormone. But no, I do not believe that it shortens the length of time for nursing.
I think
and
that
then
she was asking as well if any hormones are passed to the baby if you do the combined. Do we know if estrogen is passed at all in the breast milk?
I would think very, very little. Yeah, very little.
Otherwise, we would see effects. And as from the pediatrician side, I haven't seen any effects on babies.
Yeah, that's helpful.
And then also in terms of, there's also, if people are concerned also of efficacy, there's the progestin IUD and the implant. And so for people that you feel may not follow up, or let's say they have such a busy household or they're working, and you get a sense of that, it's important as a provider to suggest longer acting contraception that can be placed at time of basically delivery, 10 minutes after placental delivery. And so that has been shown to be very, very important for a large segment of the population who you find does not have time to return, or has great concern of being pregnant or conceiving too early after a pregnancy or delivery.
Yeah. I was just gonna say thanks for bringing up the IUDs, because I think there's a lot of people don't know much about them or are nervous about them. Can you talk about, let's say that you gave birth, didn't know about IUDs, didn't think that far ahead, and now it's 6 weeks later, you're talking to your OB at your postpartum checkup, and you start to talk about birth control options. What's the next step for IUDs then?
Well, I mean, a lot of offices could be able to place an IUD at that time. 6 weeks postpartum, you certainly can, unless there's some contraindication, such as endometritis or an unresolved issue having to do with the delivery or the hospitalization. But for the most part, yes, that can occur at the 6-week visit. It can occur at the 4-week visit. It is suggested and recommended by ACOG to make sure that you have your comprehensive postpartum exam done by 12 weeks. And it's also recommended that there should be some type of initiation about how someone's doing postpartum within 2 weeks of delivery. And so those conversations about contraception is a good time to have at the 2 weeks. So maybe a phone call, and then at 4 weeks they come in, and maybe it's an incision check or something of that sort, so that the office is prepared. They make sure they have the method on hand, insurance is checked, and so forth. So, and that the woman knows how much it will be costing. So, and of course, referrals to other places where insertion and that method are less expensive.
Yeah, so I just, as long as I'm CEO of Pandia Health, we will always tell you what's best for your health, even if it doesn't benefit our bottom line. And we obviously cannot do the IUD implant or shot, but we all are in agreement that the IUD with hormone is the most amazing form of birth control out there for a lot of people. If you don't have any side effects with it, which most women do not. About 30% of the women that go on the IUD with hormone have no periods, and they're like, yeah. And then the other 70% get lighter. And so no downside to that at all. The other thing we want people to know about is, thanks to Obamacare, the Affordable Care Act, if you have insurance and your insurance isn't a religious organization or declared a religious or moral exemption, all FDA approved methods of birth control for women should be covered with no copay, no deductible, aka free. And that includes insertion, which is really cool. But I just spoke to a group, and it doesn't include the removal, which I think is horrific and crazy. But technically you could remove it yourself, but I wouldn't recommend that. I would absolutely recommend seeing a professional. But I just wanted to say that it's that reversible, because a lot of people are like, you're putting something in me and you're going to sterilize me. And it's like, no, if you really wanted to, you could reach up with some tweezers and yank it out, But right. I also have a friend that's making a device that'll eventually come out for $25 that you could do the self-removal better. I'm curious as to what that's going to involve, but I think it's horrific, and I would rather approach it from, we should just cover removal. So just want people to know that in general, it should be covered under the Affordable Care Act, unless you have a religious employer or an employer that claimed a religious or moral objection to covering birth control. So, and particularly in California and some other states, liberal states, they've passed laws, even if the Affordable Care Act is reversed, which there's some risk of that depending on the Supreme Court and whatever, whoever's in control in the Senate, it will still be covered in California, but I can't say for other states, not like Colorado or Kansas or Texas or other states there.
Yeah, fair enough. So that's a great point, that when you are ready, if you are using this as, maybe long-term, maybe you want to wait 2-3 years to have another child, this might be a good method because you just set it and forget it, kind of, right?
Mm-hmm.
But you do need to schedule an appointment to get it removed, unless you want to. Would it be painful to do on your own, would you say?
I think it just would be difficult because you'd have to find the strings and you'd have to be able to grasp them, right? Dr. Culver, you want to?
Yeah, I think I would. I think someone in the healthcare industry that's been putting them in or removing them could probably figure it out. But no, I wouldn't recommend it.
Yeah, I think you need the visualization. So I would recommend someone else doing it where they can stick in a speculum, look, and then grab the strings and pull, as opposed to you trying. Yeah, it's theoretically possible, but not necessarily recommended. But I think the key is to know that the IUDs with hormone, there are ones that last a shorter time, like 3 years, but I don't like those as much because they have lower hormone and therefore you have a period or a bleed every month. And my thing is, why bleed unless you're trying to have a baby? So that's the one beauty of pregnancy and breastfeeding, was there wasn't any periods for a while, but periods are optional. We want people to know that. And if anybody wants to learn more about it, you can go to pandiahealth.com/periods optional. On the bottom is my TEDx talk on why we don't need to bleed every month. The only reason that we bleed is you build that lining, you wait for an embryo, no embryo, and then you bleed. And so if you're not trying to wait for an embryo, you don't need to do that building and bleeding and building and bleeding and building and bleeding every single month.
I love it. Periods optional. I think that's a great takeaway.
It's a good mommy hack.
Yeah. Yeah. Who wants to have periods, right? I don't think, unless you're trying.
Right.
Yeah. So you also mentioned about IUDs, about side effects, and we can talk a little bit generally about side effects, about different methods. But first, maybe, is there anything that you could expect postpartum specifically? Like, would the method that worked for you before, would it have the same side effects, different? How much do we know about that?
I wouldn't expect it to be any different. The main risk is just the whole estrogen thing maybe affects your breast milk. But Dr. Culver?
Yeah, I unless you're talking about diaphragm caps, so forth, those need to perhaps be reevaluated. I believe the cap is not recommended after you have a vaginal birth. And then diaphragms would need to be refitted. But in terms of oral contraception or combined hormone contraception, there shouldn't be a difference. However, during pregnancies, people do have medical diagnoses that come up, such as gestational diabetes or hypertension. And so things that happen during pregnancy really have to be reevaluated postpartum. And depending on what that pans out to be, or and how one decides to proceed with addressing these concerns, then perhaps certain contraceptions are better than others. So using a progestin only for a while someone has mild hypertension is probably best and is best. And then, of course, gestational diabetes. And you've got to make sure you've followed up with having the confirmatory test, and to make sure that annually that you're being evaluated for that. And those add different risk factors for using contraception. So that would be my advice, is to make sure that everything that occurred during pregnancy is looked at comprehensively afterwards, and then making sure at that time that if you are their primary care physician as the OBGYN, that you take that responsibility, that you don't let certain issues drop off. And if someone has also a internist, then you can say, oh, can you please make sure that you follow up with, the the diabetes workup, or after delivery, and make sure that that's documented and that you've collaborated. So that those are really important. The handoff, and making sure that all the T's are crossed and the I's are dotted, and then choosing the right contraception afterwards.
Yeah, so I think the take home there would be, if you were on the pill before, it doesn't mean that you could continue on the pill. You definitely should discuss it with your provider, because if you developed hypertension or you developed diabetes during pregnancy, those would be reasons not to be on a normal birth control pill. So you can't just start up your pack of pills again. Please talk to your provider to make sure you're safe to go. And for most people, unless you were told you got this during your pregnancy, you should be okay, but it doesn't hurt to check, and they should check your blood pressure. They should check in on diabetes and stuff like that. So don't just start up your previous birth control, definitely, except for condoms. Talk to your provider first.
All right. Well, I have another question that seems to come up pretty often, and it's not just about birth control, but we can focus on birth control here. There's a lot of confusion that comes up after, the 6-week postpartum checkup, which might not happen exactly at 6 weeks. Maybe it happens at 8 or 10 or whenever. But it seems like at that point, your care often is handed back to a primary care physician. And so if, for example, you didn't bring it up at 6 weeks, just, didn't get covered, or maybe you had different thoughts. Maybe you thought you were just going to use condoms and then realized, maybe it's going to be a long time until I have another kid, or maybe I don't want to have another kid. I changed my mind. So maybe it's 3 or 4 months postpartum. Who do you go to? Which provider is the right person to talk to? Is it your OBGYN or is it your primary care physician?
You have a primary care physician here and you have an OBGYN. So, I would say that there are some primary care physicians that are comfortable putting an IUD, and certainly the implant. My joke is my 10-year-old could learn to put in the implant, as any 10-year-old could, because you just have to locate this section, numb it up, insert, and put a sticker on it, not even stitches or anything like that. And then it works for 3 years. The shot, for sure, your primary care physician can do that. And then if you want the pill, the patch, the ring, you can come to Pandia Health. Or if you're prescribed the pill, patch, ring, we're here to deliver it for you. But IUD and certainly sterilization and more, advanced procedures definitely would require an OB-GYN. But there are lots of primary care providers that are now learning to place an IUD. Mm-hmm. So, Dr. Culver?
Yes, there's actually family planning fellowships that have both, they even have pediatricians, adolescent pediatricians, and primary care specialists, and family practitioners and OBGYNs working together to make sure that wherever they land, they keep graduating them, but wherever they land, that they are going to provide comprehensive care. So again, so that certain groups of people are given the option of all choices. And so that's occurring at mock speed, actually. They have family planning fellowships all over the country. And in terms of, nurse practitioners are also well-trained. So there generally are nurse practitioners in busy offices. Certified nurse midwives in certain rural areas are trained. It's important to call, if you're initiating contact with a new office, to call in to make sure that there is someone who can provide that service, because there are certain trainings that have to happen with specific, like Nexaplon has a training program that you have to complete in order to do the insertion. During this pandemic time, though, it's really important that telehealth is accessed and used, because, Again, we want all options to be available to patients, but it's that bridging, that time period of bridging, which means, someone's not yet comfortable or can go to a provider to have a long discussion, but is able to access telehealth and be prescribed something that really should be basically over the counter. The American College of OBGYNs, recommends and has recommended that birth control pills in an uncomplicated, low-risk patient should be over the counter. So in terms of bridging, there's just, a few questions, a few physical parameters, and then people are good to go until they can go on in and have an extended visit with a family planner or a provider who offers family planning.
Yeah, and a good resource if, most primary care providers should be able to talk you through all your options, whether or not they can personally provide it. And so just make sure that whoever you choose, be it online or in person, that, that you have all your options, the IUD, the implant, the shot, the ring, the pill, the patch, all of those options are out there. So just make sure that you get all those options. And if you want, providers that we know that provide all options, Planned Parenthood always provides all options. Also, Title 10 family planning centers, you can Google those. Those are government funded family planning centers, should offer all the options. And then bedsider.org or Power to Decide, both of those also have listings of, if you want an IUD, here's a bunch of providers. It's not a comprehensive listing, but at least, it's a sampling, and most physicians or providers can refer you if they can't do it themselves.
Great.
All right. I think we're at the half an hour. If you all want to say any closing statements or any take-home messages or whatever, let's go for it. So Sara, what is your conclusion or take home or whatever you want to pitch?
We're here to help new moms feel empowered and informed after childbirth. And so I'm glad we had the opportunity to have this event today so that new moms can know exactly what they should do, how to do it, and how to make those choices, because that's so important, and we're here for you. So I think that's my message today.
Great. And Dr. Culver, any tips or conclusions or pearls you want to send people off with?
Yes, I think it's important to be knowledgeable. There's so much information even on Pandia's website about all different options, and very well written, very great description, and with great ease. Telehealth, especially during this pandemic time where one feels like they can't with ease go to see their provider normally, there are ways to access expert help and expert advice, and to make sure that patients are empowered to do so.
Great. Well, I just want to thank both Dr. Culver and CEO Sara Bates of MamaMend for joining us today and sharing your expertise and knowledge and bringing in the different audiences. And my pitch out there is support female-founded, female-led. Check out who the CEO and the founder of the company is and what are their values, and maybe choose the one that's female-founded, female-led, or the one that's doctor-led, who will look out for your health and who has, taken the Hippocratic Oath, do no harm, when you're choosing between different companies and all else is the same. And then for telemedicine, absolutely safe for the birth control pill, patch, ring. And that's what we are here for at Pandia Health, expert care by expert doctors. We have YouTube videos, we have blogs, we have frequently asked questions. We have this Facebook or Instagram live every Tuesday at 5:30 p.m. Pacific. And for those in Espanol, at 5 o'clock Pacific every Tuesday. So any questions you have for us, definitely hit us up. And if you are in Arizona, California, Florida, Texas, or Wyoming and want expert care by expert doctors, you can enter code MamaMend for $5 off your doctor's consult to write the prescription. And it's just $20 once a year to use our amazing physicians like Dr. Culver and myself for the entire year to answer any follow-up questions on your birth control or to help you find the best birth control pill, patch, or ring that works for you. If you want the IUD implant or shot, can't help you there, but we can advise you to find a local provider if necessary. So thank you all for joining us. Support female-founded, female-led. Check out MamaMend for anybody who's postpartum or going to be postpartum, and share Pandia Health and #periods optional with anybody you know that's bleeding 1 week out of 4. Save them that bloody grief. Thank you.
All right, thank you.